The News Channel 5 Network. This is Medical Mondays.
Good evening, everyone. Welcome to Medical Monday. I'm Carrie Sharp. So glad you're here with us. This is always an hour of learning, and I want to remind you right off the bat, it is your chance to call in, get some free medical advice for once in your life, and hopefully get some answers to perhaps problems that have been bugging you for quite a while. I have a great expert here with me today. Today's topic, by the way, is female urology and chronic pelvic pain. Some of the topics that we don't go around talking about all the time, maybe a little bit embarrassing. Tonight is your chance to call and get some great advice. We have Dr. Barry Jarnagin here. Thank you for coming in.
Thank you for having me.
You say your patients call you Dr. J. That means you have a good rapport with them.
Dr. J.
You are a urogynecologist.
That's right.
What is that?
So urogynecology is kind of somewhere in between urology and gynecology. So I'm considered an expert sort of between, I tell ladies, between the belly button and the knees. So that's kind of my expertise.
Okay, so tell me some of the symptoms, some of the issues that people walk in your office for.
So it's kind of generally called pelvic floor disorders, so things that occur in the pelvic floor that are related to the trauma of childbearing or prior surgery or age related. So women can have chronic pain, and actually 1 in 4 women walking around have chronic pain at some point in their life. Urinary incontinence, depending on age, 1 in 2 to 1 in 3 women walking around with have urinary incontinence. And then fecal incontinence, or the losing stool, actually occurs statistically about 18% in the female population. So all these things can be occurring, and you're right, these are things that women don't talk about, and they kind of suffer in silence.
And there's no reason to.
There is no reason to, because most of the time we can help ladies with minimally invasive treatments. Sometimes no invasion at all, or sometimes minimally invasion, we can make them better.
You know, and probably, as you mentioned, a lot of women are walking around with urinary incontinence and other issues, and they may not know that this is actually a thing, and there are actual treatments to help this thing that they've been dealing with and not telling anybody.
Well, that's exactly right, and your point is well taken in that a lot of women think it's the norm.
Yeah.
I'm getting older, so this happens, and that's absolutely not the case. Pelvic pain, urinary incontinence are never ever normal, and there's easy things that can be done to fix them many times.
Do you find that once women make it to your office, they're kind of at the part where they're pulling their hair out, like, I can't take this anymore, so I'm finally doing something?
Yes, absolutely. And in the case particularly of the women who have kind of gotten to the end of their rope, like the ladies who have pelvic pain who never thought they were going to be able to get helped, or the lady who's had urinary incontinence for such a long time, may have had other treatments that didn't work, felt like they were going to have incontinence for the rest of their life. There are many times women will actually break down and cry because of the relief of being able to find a way to get help.
Well, I want to invite everyone again, if you have a question that covers any of these topics, go ahead and call in tonight. We are waiting for your questions. The number to call is on the screen. 615-737+ is the number to call. And I often find with Medical Mondays, once 1 or 2 people call in, people are like, okay, I'm brave enough to ask my question now. Just go ahead and give us a call. This can be an anonymous phone call. Dr. J is here to answer your questions. You have plenty of experience. You've seen it all, probably heard it all at this point, don't you think?
There's no question about it. I tallied it up and looked, I think, unless I missed somebody, I'm not the oldest, but I'm the longest acting urogynecologist in the state.
Really? And I'm sure you've seen a lot of treatments change over the years.
It has changed a whole lot. Like in the case of incontinence, when I first started, for a particular type of incontinence, I had one medication I could use. Now I have multiple medications, plus I can Botox the bladder, plus I can put in a pacemaker for the bladder. I've got a whole bag of tricks now that I can pull out and use, and when I first started I had one drug.
One drug, that was it.
Yeah, so the advancement has been significant.
And probably because so many people are dealing with it and now talking about it a little bit, and of course you see the commercials on TV too.
Yes, and that certainly helped, and the more treatments that there are available, and the more people start talking about it, the more other treatments start to occur.
Well, let's jump right in. Let's talk about urinary incontinence. There are 2 different kinds, is my understanding. Can you explain that?
So there's actually more than 2.
Okay.
So there's what's called stress incontinence, which is the typical is when women laugh, sneeze, cough. It's a weakness in the wall of the vagina where the urethra kind of swings. And so that's one kind, and that's primarily related to childbirth or prior surgeries. Then the second kind, most common, is what's called overactive bladder or urge urinary incontinence, and that's more related to either the muscle of the bladder or the nerves that feed the bladder. And that's where the bladder is just overactive, and it is contracting even when the brain doesn't want it contracting.
So you may not have a full bladder, but you feel like you have to go.
You feel like you have to go, and your bladder is contracting down and causing it to quote unquote spurt.
Okay.
The third type is where kind of the opposite of that, where the bladder will not contract at all. And that's so women walk around and the bladder is completely full. And it's kind of like, a cup that's, when it gets hit, it spills.
Sure.
And so they leak because of that, because it's chronically full, and they can't empty at all. And then there's a fourth kind, which is kind of called mixed incontinence. It's a mixture of stress and urge, and so they have both problems. And they're the ladies that come in and I go, you're not the lady I can do one thing and fix. You're gonna, we got to fix every issue that's ongoing, but generally we can still get them better, and still it's minimally invasive. It just is going to require 2 things to do instead of 1.
Well, let's start talking about prevention. If folks don't want to get to this point where they're coming to see you, is that possible? Can you prevent incontinence?
So I wouldn't say you could necessarily prevent it. You can certainly reduce the risk.
Okay, how?
Because there's what's called modifiable risk factors, and that is genetics, which of course we have nothing, we can't do anything about that. And if you've had babies, you can't go back and change that.
Undo that damage, that's been done.
And then there's what has transpired in your life to get there. We know that, for instance, there was a study that showed women who parachuted for a living. It was a military study. Even if they'd never had kids, they had an increased risk of incontinence because they were constantly banging when they hit the ground. And so behavior that's occurred up until the time they walk in my office. Now, all those things are non-modifiable. There's nothing you can do about those. The things that you can modify are, first of all, if you're going to get pregnant, you want to maintain a weight. You want to listen to your obstetrician. You want to do all the right things. You want to exercise during pregnancy. You want to have a controlled delivery. And so those things are going to offer some value. Not gaining a lot of weight. So keeping your weight down makes a big difference.
Just overall, more
just
outside
overall.
of pregnancy.
Chronic constipation increases the risk of getting urinary incontinence and pelvic floor dysfunction. And so those are all things that you can do to prevent. So keep your weight down, stay active, try to stay in shape to the degree you can, and don't get chronically constipated. And those are things that you can do. And then the other thing is diet. So there's certain things that are irritating to your bladder, and if you eat and drink those, you're more susceptible to having problems. So sodas are...
They're the culprit of everything.
Yeah, so if you're a soda drinker, try to limit it. Spicy foods, acidic foods are all things that are irritative to the bladder wall and can cause it to... smoking is a big issue, so if you smoke, you should quit. And smoking is 2 things. If I biopsy a lady who smokes, you can actually get nicotine in the bladder wall. So nicotine kind of hurts the bladder primarily, but secondly, it causes you to cough, and so you have a chronic cough, and you put chronic pressure to the pelvic floor. And so if you smoke, you should quit. And so those are things. And then caffeine is another offender, and alcohol is an irritant. So if you're going to do those things, you want to do them in moderation.
Okay. So many questions to sort through, and I know you have some at home, so go ahead and give us a call, 615-737. Plus, we'll get those lined up during the break. Don't be ashamed to ask any question you need to tonight. We're going to get you answers. We're coming right back.